Hi everybody, my name is Rachel and today I will be presenting video for a module 15 from anatomy, and this is my card with like the list of steps that I need to take to not forget anything in this video presentation. The 5 structures that I chose are the frontal bone, parietal bone, temporal bone, occipital bone, and the auricle of the external ear. And this is my fiance Daniel, and he's being very kind to let me use him as my model. So here we see the frontal bone and like the cranial structure. Here we have what we call the temporal bone. Here we have the left parietal bone. Here we have the occipital bone of the cranium, and lastly we have the auricle of the external ear. Thank you. Okay, so all of the cranial bones, like I mentioned, frontal, parietal, occipital, and temporal form part of the skeletal system, and their basic function is protection of the brain and the cerebellum, since they enclosed those organs, and they are hard structures. Made of bones. The auricle of the external ear, which I showed here on my fiance, is part of the nervous system, and it surrounds the external acoustic meatus and plays a role in the hearing and equilibrium properties of the ear, since it collects the sound waves and channels them into the ear canal. The other step is the importance of surface anatomy, and then like surface anatomy is super important since it allows students and medical providers to palpate, and by doing so identify anatomical structures of a living body. This allows for proper physical examination, which is of the utmost importance when it comes to diagnosing and treating a lot of conditions in the medical field. And I think that every single provider should be very well trained in this prospect of palpating and examining their patient. And the other one's like clinical applications of tool structures and explain. So as a PCP, as a, like any provider and physician assistant, which is what I want to like the field of medicine that I would like to go into, I will be seeing a lot of patients from different backgrounds, and I believe that is very important for me to know if the patient mentions for example that he like hit the front of his head and that hurts, and that if he shows signs of edema or facial paralysis or disorientation, this might be a sign of a concussion or a bone fracture of the frontal bone of our cranium. So like this is like super important for me to notice right away, be able to palpate it, examine, and maybe like do x-rays or any other kind of exam that I could do for a proper diagnosis of treatment, and also prevention of later on symptoms and that the patient might suffer from this injury. Another clinical application I chose it is like from the for the ear, the auricle of the external ear. So a very big thing in our society now is the auricular therapy. Even though I probably will not be practicing this part of medicine, I would like to be very well informed and orient my patient towards the best course of action for them in particular. And I believe that like this kind of therapy helps relieve pain, like calm the mind by reducing anxiety, treat allergies, and much more. And like apart from that, another clinical application from the article of the ear is since it orients sound waves towards the inside of our ear, and I think like because of that it is of extreme importance to protect and like clean it properly on daily or weekly basis or monthly basis. And a lot of people tend to clean it with like their own nails at like all times, and this can cause a series of infections that could travel into the ear and cause otitis or other series of conditions that could impair the hearing abilities of the patient, or cause like other series of conditions as well. So I believe that as a provider or physician, on a physical consult, which is like once a year, it would be very useful for our patients to be informed in order to prevent future health problems related to this part of our body. Thank you so much, everyone. Have a wonderful day and good luck with your exams. Bye bye.